What's up, guys? This is your COVID-19 daily update brief. I got to apologize. I had to take a couple of days off for some things that were going on in my life that I had to complete and put some effort towards and all my energy towards. So this kind of went on the back burner. However, we're going to jump into some numbers tonight. Unfortunately, I'm not going to go into some of the headlines and talk for that just because of some time constraints. So again, we're just going to go straight to what's going on. So I'm going to kind of talk to you about the last few days, but basically focus on the last 24 hours. So right now we're at 1.5 million confirmed cases globally. Roughly that was up by 300,000 since my last update. And then total deaths is 88,334, which is roughly about 20,000 death increase since my last update, which was on the 4th. So I said that it would double by the 11th from 1.2 to 2.4. Again, I don't really care too much about that. The US case fatality rate, guys, has not changed in the last few days. That has been even at 6%. It remains 6%. So again, we're starting to level off somewhere between that 5 to 6.5% range in this last week. So that's a good thing. That's indicative. However, with the amount of cases that they've tested, we still don't know if that's an accurate number. I assess it's probably lower, probably somewhere right around 3.5 to 4, kind of closer to this global case fatality rate. But again, what we're tracking right now for the actual confirmed cases with the deaths is 6%. Next, the key assumption I made on the second, saying that the United States would double by the 5th. That did not happen. On the 5th, we were right around like 9,800 deaths. Let's see. Uh, 9,500. 9,498 deaths. So that didn't happen, but what I'm kind of tracking towards right now, and again, I told you guys that that wasn't going to be happening because we were dropping from like 30 something percent deaths over 24 hours to high 20s to mid 20s to low 20s to at one point like 14%. So that was dropping dramatically. But right now, what I'm assessing is that we will hit the 20,000 death mark by the 11th, most likely by the 10th. However, if we have another day where we dip, actually, I'm going to say the 10th because that's what I'm tracking right now. So just in 2 days, guys. So U.S. death rate will reach the 20,000 mark, and that's based off of what I've been seeing over these last 3 or 4 days. So right now we're averaging just in the last week an 18% average death rate over a 24-hour period. So according to that and what I've seen the last 3 days, this is my projection right now that we'll reach the 20,000 mark by the 10th. And I have that right down here too. It matches up with the key assumption that I made on the 5th. We were saying that by the 12th, the U.S. would pass Italy and Spain. Guys, right now we basically have passed Spain. I mean, Spain's at 14,792. We're at 14,736. So we are most likely going to pass Italy as well by the 10th, and that's when we reach that 20,000 death mark. So again, we'll kind of pay attention to that, and that's based off of what we've seen over the last couple of days to week. So right now, what we're seeing for countries, United States, United Kingdom, and France are doubling every 4 to 5 days, closer to 5 days. Germany's every 5 days right now, closer to 6. Spain has jumped up to 11 days, and Italy has passed the 14-day mark. They're about 14, 15 days, so they're every 2 weeks. The good thing, guys, though, is right here. I want you to focus on these numbers, the percent growth over the last 24 hours and the last 5 to 7 days. Uh, Germany had a big jump. That could likely be, if you guys remember, France had quite a few jumps like 4 or 5 days ago, and that was actually because the deaths that were happening earlier on in the nursing homes and the nursing communities, right? Those numbers weren't factored into the country's deaths totals until like 2 weeks later, once they got all those numbers tallied up and whatnot. So France had like crazy amount of deaths over like a 48-hour period. This could be what's happening in Germany, so we'll track that. I'm not sure because Germany hasn't really been uh, jumping too much. I mean, they've been decreasing. So this is even an increase over the last percent over the last week. So again, I'll kind of track that and see what's going on. And then right now in the United States, guys, the only states that don't have a statewide order to shelter in place and to stay home are still North Dakota, South Dakota, Nebraska, Iowa, and Arkansas. Last time I showed you guys this, South Carolina did have a partial statewide order. It was just Columbia and Charleston cities. However, I think it was yesterday that they ordered statewide. And then Wyoming, Utah, and Oklahoma still have those kind of partial, where just major cities right now have the shelter in place or stay at home order. So we'll continue to track that, see if all the states eventually go to a shelter in place. And then the big thing, guys, that I want to talk to you about, which is some good and bad news. We'll blow this up like we normally do. So since we talked over the last, what has it been, 3.5 days, the United States has jumped from 8,200 to 9,200 cases in the ICU, so serious or critical cases, right? That's 1,000 patient increase. Spain went up roughly 500, 400 and some change. Italy continues to go down, guys. They went from 3,994 to 3,693. Germany went from 3.9 to 4.8, so they increased by 1,000. And France actually dipped too. So again, remember when I said that France had those crazy numbers and people were kind of freaking out, like, why is France posting 1,300 deaths in a day? It wasn't because they had a large amount of people that were getting sick and dying. It was just because of the nursing homes. However, active cases, guys, U.S. increased 100,000 active cases just in the last few days. Compare that to Spain, who only went up 5,000, right? Italy, that went up by not even, what was it, 88 to 95, so that's 7,000. Germany from 68 to 64, so they dropped. So again, what we need to focus on, guys, is this number is important, but this number correlates with this number, right? Because as the cases continue to go up, expect a large amount of these cases, or maybe not even a large amount, right? But a number of them are going to continue to turn serious or critical, right? And these are the cases that are unfortunately dying at a large rate right now. So again, Italy and Spain are continuing to plateau. It's going to be a long plateau though, right? With 100,000 confirmed cases right now and 7 and 4,000 people in ICU. So it's going to be that long drawn out plateau. Don't expect it to go away anytime soon. However, things are getting better, if not slowly. So jumping into states right now, this is the graph with New York State. So New York's at 149,000 confirmed cases, so 150,000, with 6,268 deaths. Right now, states are doubling every 5 to 7 days in states confirmed as far as their confirmed cases go. And then the deaths by state has actually, this is a good sign, guys. New Jersey, Massachusetts, and New York are doubling every 4.5 to 5 days. So states were doubling every 3 days. Now the fastest one is 4.5 days right now, or 5 days. It was actually South Carolina that had the biggest increase. It wasn't New Jersey. South Carolina had the highest growth in the last 24 hours at 24%. However, that was only 51 deaths to 63 deaths. So if you guys are curious, New Jersey's at 1,504 and Michigan is at 959. Third is Louisiana at 652. And then we have Illinois, Massachusetts, and I believe it is, what is it, California? There we go. All right around like that 450 to 460 number range. I told you guys about a week ago, expect 3 of these to be at 1,000. That was New Jersey, Michigan, and Louisiana. Louisiana actually slowed down quite a bit. They didn't quite get to 1,000. They're at 652. However, Michigan and New Jersey definitely reached that 1,000 mark within that 5 to 7 days that I had predicted. So again, we'll continue to watch these, especially New Jersey, as they continue to grow and climb at a fast rate. But again, I even expect these to start to slow down, right? We're not going to see anything astronomical like New York over the next 2 weeks, 3 weeks. New York was a special case. The shelter in place, people staying at home, not going out as much, is effective and it is working, especially now that the CDC is forcing everybody to, or not forcing, right, but recommending everybody to wear masks. Some workplaces, some work centers are forcing their people to wear the mask if they want to come in. So again, that's all going to help slow down the transmission and the spread and the infection of the virus. So my projected growth, again, if you guys want to see this, this is according to today's numbers, what we're seeing as far as the growth over the last 3 to 5 days. So right now, again, on the 10th, expect the U.S. to pass Italy at that point. We've already passed Spain, in my opinion, right? We're right there with Spain, neck to neck. Italy is going to be somewhere on the 9th or 10th, most likely kind of towards the 10th, possibly even the 11th, if we have some slow days over the next few days. But I wanted to show you guys this graph too. I show it every couple of days. Just want to reiterate the fact that we are starting to plateau, right? Some of these countries are starting to plateau. Italy, Spain's not on here right now, but the US, if you see here, right, we're just at that point that we're almost reaching our peak. Right now, the peak in the US, the apex is assessed to be right around the 12th. So in the next 3 to 4 days, guys, we're going to hit our peak. It's going to slowly kind of stay high for a little while, and then we're going to slowly start to decline, right? It's going to be a very slow, very long plateau as we decline, like all these countries. But the good news is it is going to start declining. However, that doesn't mean that we need to lessen up on the shelters in places. That doesn't mean that people can start moving around more. That doesn't mean that you don't have to wash your hands 5 times, 6 times a day whenever you go out in public, touch things. All those things still need to happen, or we're going to be looking at a second and third wave, which is still a possibility, right? So that's why it's still important that we continue to take the safety measures to keep the virus at bay and don't continue to spread it while we look at kind of reaching our apex and then hopefully plateauing and going downhill from there. So that was your COVID-19 daily update, guys. Again, April 8th. That was current as of like 2015 Eastern Standard Time. I grabbed all that information. Again, I'll try to get you guys a daily update tomorrow, hopefully sometime in the afternoon, but it'll probably be in the evening. So hopefully all this information has continued to help you guys out, and we'll continue to track this over the next couple of days.